Well, welcome. It's an honor to have you here. And before the evening is finished, I hope that we can answer some of your questions about what people think is the hype about gluten and leaky gut and autoimmunity. First, I'd like to thank Ruggles Green, the Woodlands, for catering this wonderful gluten-free meal. They have many gluten-free options available, and it's our family's favorite restaurant here in the Woodlands. Included in your folder, there's a coupon and a menu, and so I think that you should go ahead and take that in and use it for sure. They have a total of 5 restaurants around Houston for your dining pleasure. And the gluten-free brownie dessert tonight is yummy, but you have to try their paleo sweet potato pie. Paleo means gluten and dairy-free, but this pie is also sugar-free, and it's really good. So second, I would like to thank Metagenics for providing information about their gluten digestive enzyme in case you're accidentally glutenized, as I call it. The spectrozyme breaks or cleaves or cuts the gluten from the outside. Those are called exopeptidases, and then from the inside, those are called endopeptidases. So if you're sensitive to gluten and you go somewhere and you accidentally ingest it, and you're in a lot of pain, the enzyme breaks it down. This doesn't mean that you should eat gluten and just take enzymes, okay? And I'll explain the reasoning behind that a little later. Also, as I discuss genetics tonight, because that's really what's changed in the last several years about what we know about disease, because it's changing everything. You probably heard phrasing and some of the political talks about precision medicine, but it has to do with looking at your genetics, and it doesn't have to break the bank to do that, but it's really going to change the way that people are treated and diseases are treated going forward. Basically, as you all know, we really don't have a healthcare system in the U.S. We have a disease management system, and it didn't happen like that overnight, and that wasn't the purpose, I believe, but it's just morphed. And so we have an epidemic of chronic disease, but especially autoimmunity. So what's that mean? Autoimmunity is where your body attacks itself, very simplistically. So last year, more people were diagnosed with autoimmunity in the United States than cardiac problems, heart disease, and diabetes combined. So we need to ask ourselves why, and I'm going to touch on those and address those tonight. So as you all know, that there is an epidemic of chronic disease in the United States and the world. The standard medical models of treatment and practice have not proven to be effective in the treatment of chronic disease, and chronic disease and its treatment are extremely costly on a national scale. I love this slide because it's kind of like what we've been doing for a long time. We're just going, na, 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 and we've got this tsunami of chronic disease. And the U.S., we have so many things that are great, but since like the late 60s, early 70s, the entire generation that I grew up into now, we've come full circle. We have disposable diapers, we have Tupperware, we have herbicides and pesticides, genetically modified foods, but now we're reaping the consequences because we have all these toxins built up in our environment. Functional medicine promotes the individual's health and vitality by examining each patient's unique biochemical makeup, medical history, lifestyle, and environment to identify underlying causes of disease. So we go through that list. Is it toxins, microbes, allergens, poor diet, stress, or a combination of all of them? And I'd like to add one more thing to this. When we look at nutrition at the microscopic level and your genetics, that's what changes the way we care for each person now, and it's that precision medicine everyone's talking about. Chronic diseases are multifactorial, so antecedents predispose individuals to chronic disease. Triggers and triggering events initiate the chronic disease process. So any given, and mediators perpetuate the chronic disease process. Any given factor can fill any one or all of these roles depending on the specific circumstances surrounding a patient and his or her disease process. a host of imbalances exist that can lead to that disease state. So treatment really must be personalized to target a host of imbalances. An example would be obesity. Obesity can result from chronic inflammation, hormonal dysfunction, heritable factors, lifestyle factors such as diet and exercise, and psycho-emotional dynamics. So conversely, one imbalance in a patient's physiology may lead to a diverse array of chronic disease conditions, so not just one. So chronic inflammation can lead to any combination of heart disease, depression, arthritis, cancer, and diabetes. All right, so this is something that now is computerized. It's a way to kind of map out a person's timeline. You come in, you say what your problem is, but then you look at their life, where those antecedents are, their family history, what genetically predisposes them, what happened. You get to spend time with them and look at their life. And at the center of our lives, when mentally, emotionally, and spiritually we're taxed to the core, so much of the time we don't look at what stress does to us with our families, our work, toxic jobs, stressful environments. And, we all have a God-shaped hole inside of us, and that's at the core of everyone. And so that's one thing that I really appreciate about functional medicine. So this is called the functional medicine tree, and these are the things that we can change. Our sleep and relaxation, what we do, how much water you drink, and what kind of water. The types of relationships and people we spend time with, do they help us? Do they encourage us? Or do they kind of sabotage us when we're trying to do something to help ourselves? And then all the different types of toxins. And then, you've got your genes, but even if you have bad genes, it doesn't mean those genes need to be expressed. All right, and here's what our current system does. You go see the cardiologist because of your hypertension, and they put you on your hypertension med and your diuretic, but no one takes a step back and looks and goes, well, what's going on? Why are you inflamed? Why is your blood pressure up? What's your diet like? All the years at the rheumatologist, no one ever said, well, what does Sarah eat? That's really critical. This is the old paradigm. This is what we talk about. You go see everybody. How is it connected? And I'm not going to pursue, it's get a pill and you just tack it on. So we're really asking the wrong questions. So basically, this is just to say that everybody's different. We've got markers now to show us which drugs will work and what won't. And when you have your genes, what you bathe your genes in, what kind of food you have, all those other lifestyle factors. Okay, so the questions we should ask, what do we need to get rid of? And what do we need to add back in, if it's one thing or multiple things? So we should seek the cause first. And look at all those factors, and then what can we do to change things? And we all need hope and a purpose, and I put that at the bottom of that, your sheet. There was one sheet in there that talks about healthy things for your brain and your body. It starts out with fish oil. Everybody can have fish oil, and good quality fish oil. So we're going to talk about the gut. We're going to get into the nitty-gritty. 90% of the neurotransmitters in our body are manufactured in our gut. I did not learn that in medical school. We didn't know that then. 70% of our immune system is associated with our gut. And there are so many bacteria in our gut. There's 100 times the amount of genetic material that we have in our gut. And really, it's more our microbes in our gut. If things are off balance, it talks back to our brain through those neurotransmitters, because many of them manufacture things that throw everything off balance. So these are, does anyone know what these are? Yes, the villi. These are healthy villi. In all of our intestines, we call them enterocytes. In the small intestine, we have a single cell layer that looks like little finger-like projections. So this is a microscopic view of villi, and the surface area on those is incredible. If we rolled out our GI tract, it would be the size, the surface area would be the size of a tennis court. And you see the respiratory mucosa, it's smaller, and then the skin surface is smaller yet. So in the entire GI tract, we digest and absorb our food, and the immune system, 70% of it is associated with the gut, and it makes sense. You breathe air in, it's exposed to our immune system. You eat, and things that you're eating or swallowing. When you breathe in viral or bacterial particles or eat yeast, it goes down your gut and it's exposed to your insides. Same with parasites. And so we digest, absorb. There's intestinal permeability. We hope not too much. There's all the bacteria that live in there that break everything down and help us to be able to utilize it. Our immune system's triggered, and our nervous system is functioning. So really hard to see, but this starts up here with the esophagus, and in the stomach, it talks about what's absorbed and what you need for it to function, like molybdenum and fluoride and iodide and copper. And then these are all the things that the duodenum needs to function. These are all the things that at the top of the jejunum, same thing here. So you can see your gut needs to have many different micronutrients and vitamins in order to function properly. The only reason I put this in here, it just kind of breaks this down a little bit more. You can see that the brush, this is just one little brush border villi, but you see how the vein and the artery and the lymphatic duct are just right there. It's just that one cell layer. It's another little picture of that tight gap junction where it kind of kisses. And you can see it right there again with that electron microscope. I'm going to talk a little bit about autoimmunity and then launch into celiac. But one thing that we've learned is that not only patients that have type 1 diabetes, well, they show a small amount of intestinal permeability and high serum levels of zonulin. So the zonulin in someone who's even pre-diabetic and has normal glucose levels, if they've got a family history and somebody checks them, they may start showing that their pancreas, which makes insulin, the beta cells, might be starting to develop antibodies against zonulin early on. So it can show up. So we used to think that our immune system seemed to control the bugs in our gut, but it may be the other way around. So community immunity is not such a bad thing. We've altered the bacteria on our skin by the use of all the hand sanitizers and all those things, sterilizing everything. So a little bit of community immunity, as I call it, isn't so bad. So what we eat does influence the population and activity of what lives in our gut. We talked a little bit about this, that antibiotics, the way we're born, what mom's gut was like, influence what's in our gut. And they're seeing more and more now, too, that the overuse and misuse of antibiotics. And this is kind of scary to me in pediatrics. So now, as I go forward, instead of seeing these kids with chronic ear infections and asthma and allergies, it's more like, okay, why are they continuing to have chronic ear infections and allergies and asthma, and what can we do? And all disease starts in the gut. So it's multifactorial, but it's kind of scary. So with the increase in autoimmunity and issues such as obesity, inflammatory bowel disease like ulcerative colitis and Crohn's and celiac, those are autoimmune. It really is looking more and more like antibiotics are really at the core of that. So we think, well, what can we do? Well, there's a lot of clean, natural agents that will kill bacteria too. So, complex diseases like autoimmune diseases, and we're going to use celiac as a model tonight because this is what has opened the door to autoimmunity, is very complex, and we're finding that viruses play a huge part in this. many times we cannot get rid of viruses. You know, think about when somebody says, oh, I've got the shingles. Well, they had chickenpox when they were a kid, or they didn't, but they got the chickenpox shot, and then they get shingles. Well, what is that? The virus lives in the nerve root, and it's called the myelin, or the fatty sheath, around a certain nerve. And when you're stressed, either emotionally, mentally, physically, spiritually, that virus replicates and comes out in a nerve root. It happens to kids too. I saw this little boy a few weeks ago and said, okay, so, oh, that's not staph, that's shingles. You see how there's little blisters here? And the parents just looked at each other and said, well, what's going on in your life? Well, he's playing baseball. And I said, well, you have any stress lately? Well, yeah, we just moved into a temporary house while our other house is being built, and I'm pregnant. Yeah, he's stressed. So, you know, shedding viruses, they trigger all kinds of things. So we're finding more and more about that now. So the gut, this is where all this takes place. The only reason I showed this is that GALT, gut-associated lymphatic system, 70% of our immune system is right here. The skin is a very small portion, nasopharyngeal associated lymphatic tissue, and bronchial associated lymphatic tissue. The gut is by far the largest. Here's a little lymph node, basically a lymph node in your gut. So here are the little villi, here's a little lymph node, and this is where you're coming through, and you've got your lymphatics and your blood vessels. So what's in your gut ends up in your bloodstream and your lymphatics. All right, so there's all different components to our immune system. So those Peyer's patches are those little lymph follicles or lymph nodes in our gut. Those big fat cells up there, that's actually what we call a dendritic cell. Well, kind of. Our gut has an immune system too. Why else would someone in a coma, they still put a feeding tube down? Their gut functions independently of their brain, their brain. And they may have life here in their brainstem or wake up, but the gut just keeps chugging. So it's unique, very unique. All right. So a lot of times people wonder why we get allergies. Well, now that we've kind of talked about how you get a leaky gut, you can see how something that looks like one of these things looks like the other. One of these things is not. So this guy looks like these guys, but he's not quite the same thing. So when we develop food allergies, a lot of it is because there's what we call molecular mimicry. Chemically, certain things slip through because they look like this, but they start an inflammatory reaction. I just like this slide too, kind of. Okay, so when your kid's eating dirt and worms, it's not such a horrible thing unless they just put a bunch of pesticides and other junk down. So anyway, okay, all this to say that our immune system is absolutely very complicated. So when junk slips through here, it just triggers this cascade. And so it's much more involved than what we realize. And fortunately, most of us don't get horribly sick. So, all right. So these are some of the things that are associated with intestinal permeability: food allergies, food intolerance, people who end up getting septic or getting acute pancreatitis, organ failure. Intestinal permeability is at the root of that, especially in folks that are hospitalized and are very sick. Migraine headaches, gallstones, chronic fatigue, multiple chemical sensitivities, and autoimmune diseases, type 1 diabetes, celiac, rheumatoid, psoriasis, and Hashimoto's thyroiditis. Any types of joint swelling, all that's tied in with autoimmunity. I love this slide. This shows us what we call a healthy gut. Those little tight gap junctions are nice and tight, so the little teeny little things that are getting through are adequately digested. So see, you can understand that, right? Yeah, the little guy who asked what kind of pizza we were having. Okay, and then this is what happens when you have a leaky gut. Larger particles come through and they're presented to the immune system, and then it triggers an autoimmune cascade. So over time, you get sicker and sicker and sicker. And depending, too, on what type of a body burden of viruses or bacteria or yeast or parasites you might have, you could be extremely sick with multiple things causing your illness. It's also really important to chew your food really well. And how much of the time do we do something else? You're looking at your phone, you're stuffing your face, or you're yelling at your kid, or you're like, do this, do that, and we're not chewing our food very well, and then we regret it, a little bit later. Okay, back to the villi. These are healthy villi. All right, so signs of gluten intolerance. These are things that you wouldn't normally think of. Fatigue, anemia, weird-looking teeth. You know how you can get fluorosis, which looks kind of like white spots on your teeth? It's different than fluorosis, but it looks kind of like yellow patches. So if somebody has alternating diarrhea, constipation, funky little things on their teeth, I'm looking at that with kids now too, because it's like, ooh, how are they doing developmentally? Are they delayed at all, or what's going on? But you'll see that. Osteoporosis, unexplained weight loss, infertility is a big one, undiagnosed celiac or pre-celiac, and just skin rashes. Okay, this guy has changed the way we look at autoimmunity. His name is Dr. Fasano, and this was in 2009. He published this article, and it really now forms the basis of looking at autoimmunity. And celiac. At the turn of the century, they called kids with celiac banana babies. And the reason why was because they didn't know then that wheat was the cause of it, but their little bellies would poof out, and they would, the only thing they could eat was bananas at the time. And they would say, leave your kids, come back in 3 weeks, and either they'd be alive or dead. And it's just very sad. So these are just examples of kiddos with celiac, but see how the belly's all distended, and these kids are all malnourished, but they've just had body wasting. And you see the same thing. What do we do when we go to other countries? We try to give kids who are malnourished grain. And what does the grain do? It causes increased intestinal permeability, and they malabsorb it, and they become more malnourished, and they may also develop just horrible diarrhea because they can't absorb any of it. So that's kwashiorkor, which is, it's essentially celiac because it's protein deficiency. Okay, and this is a cute little, you think of cute little European white kids with blonde hair, blue eyes, or red hair that have celiac. This is what those healthy villi look like when you have celiac disease. They're completely denuded, and they're just stripped away. So all that surface area to absorb all those little micronutrients is gone completely. So this is when you're at the end stage and you're diagnosed. So when you go to the gastroenterologist, if they don't do blood work, they may do blood work, most of the time they do, but they'll look to see if they can find this on biopsy. Well, it won't tell you if you don't have antibodies to, it's called tissue transaminase. When they run a celiac panel, they'll say, okay, you don't have celiac right now, but do you have a genetic predisposition for it? They're not telling you that. But this is also what you look for and say, oh, you don't have celiac. Okay, let's take that off the radar. Eat all your gluten. Okay, so this is what he found. 3 causes for celiac, but it's also the 3 causes of autoimmunity. You need a trigger, you need a genetic predisposition, and you need a leaky gut. So the 3 things for celiac is the trigger, which is gluten, gliadin, and you need one of these 2 markers, HLA-DQ2 or DQ8, and you also need a leaky gut. Now, when you say a leaky gut, we've learned that it has to do with something called glutathione. Glutathione is our body's big antioxidant. An antioxidant goes in and it cleans up free radicals. Anybody remember that from chemistry, where there's like an electron floating off somewhere, and when you eat bacon that's got nitrates and nitrites, and if you eat it, it makes a bunch of free radicals, or you burn your burger, it's glycated and it's got free radicals. you need glutathione to take care of that, and lots of broccoli. So anyway, so if you also have genetic markers that cause you not to make enough glutathione in your body in multiple different places, then you'll also have a leaky gut. Glutathione in our bodies is concentrated in several places. In the gut, in our sinus cavities, in our respiratory tract, our brain, and our skin. And that makes sense because that's where we have intestinal permeability. It's where we're exposed to different things, and we want our brain to be functioning properly. So after this groundbreaking work, here we go. So genetic predisposition, the trigger here was wheat, and then you have to have a leaky gut, and then you get disease. And sometimes it may take years and years and years for that to develop. So I'm going to talk a little bit about 23andMe. That is, we have 23 chromosomes in our body, and I'm not asking you to like rehash high school biology, but 23andMe is a pretty darn cheap way to get a lot of these markers. And something that I've started doing in my practice in part of this whole thing called nutrigenomics is by purchasing these kits, and you can buy them tonight if you want to. We're going to offer some different packages. You spit in this vial. It's very simple. You follow the instructions, and then 3 to 4 weeks later, the results should come back. But looking at your 23andMe results, and this little search engine that I plug it into called Livuelo, it'll tell you about your ability to produce glutathione, your gluten sensitivity, and something else called methylation, which I'm going to mention briefly. It's our ability to provide cellular energy. As I mentioned at the talk, we talk about inflammation control, cellular energy, and proper micronutrients and nutrition. Okay, so we talked about how the nervous system has a mind of its own. Neurotransmitters. I'm briefly going to go over these. These serve as messengers between our brain and our organs. It's like a telephone system, and you've got to have enough of them to communicate. Yes. So these are all the different things that neurotransmitters have to, that they're involved in. And all the different things we mentioned, stress, poor diet, and toxins influence those. So different stresses in our lives, toxic relationships, stressful jobs, just the difficulties of life. So sometimes we'll use our neurotransmitters too rapidly, and then over time they'll be depleted. Also, our adrenal glands take a hit, and we can't produce a response. So, and our standard American diet, that is very sad. Standard American diet does not help. We need proper nutrition to make amino acids, which are our neurotransmitters. So they're like the building blocks for our neurotransmitters. So different things. And believe it or not, when you talk about toxins, you think, well, it's not such a big deal. But actually, that's becoming more and more prevalent in the Texas Gulf Coast area, the Midwest, where there's a lot of farming, Minnesota, Wisconsin, Ohio, Indiana, Illinois, northern Iowa, and then in Texas, along, with all the oil refineries, we're finding more and more and more people with toxic burdens of lead and mercury and other heavy metals. And then people who travel a lot and work in electronic factories, there's just a heavy load. And, if you're older and you've got mercury fillings, those boogers can leach out. Anyway, so now I'm going to talk about genetics. So they can affect the levels of your neurotransmitters. So you could be just set up to have difficulty. So it's harder to make your neurotransmitters, harder to use them, or you may use them too quickly. So they affect our entire body, everything. And our gut talks to our brain talks to our gut. There's actually a probiotic that talks to the vagus nerve by making something called GABA. GABA is a relaxing neurotransmitter along with serotonin. It's like makes you feel good and happy. They fed this probiotic to 2 groups of little mice, and mice get freaked out when they're swimming in a swimming pool. They gave them this particular probiotic called Lactobacillus rhamnosus, and they were like floating in the water instead of like totally stressed out and spazzing. And that was just amazing. So we're going to talk about something called single nucleotide polymorphisms, or SNPs. What the heck is that? Well, our DNA, it's called a double helix, and they have single bases. So you probably remember A, T, C, and G, the little nucleotides way back from biology. Well, if something happens and you go in and you change one of them, depending on where it's at, it can greatly affect the enzyme that this DNA is coding for. So you are not your genes. It's what you bathe your genes in is who you are. So even if you've got markers for Alzheimer's or Parkinson's or hypertension or lupus, that doesn't mean that you ever have to have those diseases. And if you've struggled and you're having problems, you can reverse a lot of those things. You still may have an autoimmune disease, but if you have, say, Hashimoto's thyroiditis, where you've made antibodies against your own thyroid, those antibody levels can decrease and sometimes be next to nothing or zero if you modify your lifestyle and rid your body of certain toxins. So what you end up being, it's called the phenotype, because you may have something that says, okay, your genes are going to say this, but those genes aren't expressed. What you end up looking like is what your phenotype is. It's what you bathe your genes in. So what these little SNPs are, you take your DNA from your mom and your dad, and it's like a little typo. You've just got one little change. So here is an example of where you make one little nucleotide change, but it's in the middle of a very important part of the gene. And so you can see that one change, or SNP, drastically modifies the shape and therefore the function of that particular enzyme. Now, this means you're normal. We call this heterozygous, meaning you've got one copy from mom, one copy from dad, and this means you're homozygous. It's worse because and when we look at some of the pictures, this will be green, this will be yellow, and this will be red. Yellows aren't so bad unless there's a whole bunch in one particular spot, or if it's in a real critical place. Now, on 23andMe, and then the little search engine that I plug it into, this is called Livuelo. This particular gene right here, 2 of my 4 children have this where they're homozygous, meaning that this gene alone, if you don't remove gluten from your diet, there's a 20 to 40% chance that you will develop celiac disease in your lifetime. So wouldn't it be nice to go to your 5-year-old and say, spit in this cup, Susie, and figure out, well, you know what, we really ought to be gluten-free instead of, tossing the gluten at them. But you have to look at all the other nutritional things. Feed yourself a good, healthy diet, take care of that B6 and selenium we talked about. So I showed this at the beginning, but this particular probiotic, one of the things we can discover, this is what we use with my daughter, but this is Ultraflora Integrity. So, and then the Spectrazyme is over there. But this particular marker, like I said, out of my 4 children, my husband, myself, she's the only one that was homozygous for this. So what this does is that was that sweet substance that attracts bifidobacterium. And on the handout I gave you, I talked about what composes a good probiotic. You want a lot of lactobacillus and you want a lot of bifidobacterium. So it says things to bless your brain or help your brain, brain health, bless your body. You usually want about 5 strains of lactobacillus and 2 strains of bifidobacterium, and then something called Saccharomyces boulardii too. And so, but that's a good one right there. But so there's Ultraflora Integrity. I just love this. It's been studied for years, but it's this strain of lactobacillus, and it literally closes up those tight gap junctions. So, okay, the last frontier. We're going to talk about methylation. The one thing in the last several years that's tied all this together is methylation. Think, well, what's methylation? Well, this is a methyl group right here. You've probably heard that B vitamins are water soluble. A methyl group, if you slap a methyl group onto something, you're going to make it fat soluble. And to go from our blood, when we have blood tests done, the doctor measures what's in your blood, and that's water soluble usually, unless they're doing a fatty acid thing. But in order to make something diffuse into a cell, and then to be able to diffuse in the inside of a cell into the mitochondria, which are like the batteries of our cells or the powerhouses, you have to make it fat soluble to get through the fat on the outside of it. So methylation is basically a transfer of a methyl group from one chemical to another. You make it fat soluble by adding a methyl group. And so DNA methylation plays an important role in the regulation in development of disease. Methylation is like the gas in your tank, okay, or the foundation of your house. If your foundation has got a leak in it, you're going to start sagging, and it's going to cave in eventually. So if you've got a leak in your gas tank, you're going to run out of gas eventually, and what triggers it, we don't know. So there's at least 252 biochemical processes in the body that require methylation, and it involves our immune system, it involves our neurotransmitter production, and it involves our ability to detoxify. And what's that mean? It's not pooping and peeing. It means you're taking the trash out of your cells. So it's making that glutathione stuff we were talking about. So these are some of the things that you may have issues with if you've got an issue with methylation. Extreme exhaustion. Exercise wipes you out instead of feeling better, or it takes you a really long time to recover. Slow healing, slow metabolism, low muscle tone. That has to do with the mitochondria. Not everybody has that. Focus and concentration issues, mood instability, sleep disturbances, you're clumsy, loss of train of thought, poor organizational skills, mixing up words, ADD, ADHD, learning disabilities, dyslexia, if you're tongue-tied, schizophrenia, bipolar disorder, depression, anxiety, it all falls in with methylation. The other has to do with the immune system. Multiple doses of antibiotics and or steroids required to cure infections, sinus issues, gut issues, recurrent infections of any kind, yeasty overgrowth, and you just can't seem to knock it. Now, if you're an adult, these are some of the things that has to do with methylation. Migraines and headaches, vertigo, dizziness, fibromyalgia, chronic pain, reflex sympathetic dystrophy. And the thing that really irritates me is that so many physicians don't believe patients when they come in and say, this is happening to me, because many times you can't see physical evidence of it. So this is very, very real. And also these things here. For kiddos on the spectrum, asthma, eczema, sensitivities of any kind, seizures, all the learning disabilities, speech delay, migraines, immune dysfunction, kids with POTS and adults, it's called dysautonomia, where you, anyway, fainting, exercise intolerance, mitochondrial issues, social anxiety syndrome, and PANDAS has to do with strep infections that attack the brain, and OCD, obsessive compulsive stuff. So this is methylation. You throw a methyl group on something, and there's all different kinds of cycles in the body, but this has to do, this 5-methyl tetrahydrofolate. Folic acid has to get into our cells and then be utilized. So it gets transferred around. You add the methyl group on and it transfers around. Then it goes through another cycle, and cobalamin and methylcobalamin, that's vitamin B12, but it's methylated B12. You can take B vitamins, but if they're not methylated and you've got a methylation problem, then your pee is going to be really, really, really yellow. And that's because you're not using it. You got to have methylated B vitamins. And then here, we've got something called methionine, and then it goes down to homocysteine. You hear about people with homocysteine that may be too high or too low, homocysteine being high associated with strokes and cardiovascular disease. Well, it's all involved with methylation. But adenosine, this goes on to make DNA. So those methyl groups are used everywhere in the body. The only reason I threw this in here is just to show you that this is a lot more complicated than saying, okay, I have this gene or I have that gene, I need to take this, I need to take that, because everybody is different and you don't want to get too much of one thing, too much of another. But the way that our body is so elegantly designed that underpinning all of these reactions, many of the cofactors, meaning you got molecule A, molecule B, and you got this enzyme, 5-methyl tetrahydrofolate reductase, people say MTHFR. Well, the cofactors are things that you need to go from molecule A to B to work with the enzyme. So it might be vitamin B12 that's methylated, vitamin B6 that's methylated, or copper, or zinc, or magnesium, or manganese, or all these things, or selenium. So all those things are really important, and over time we can become depleted of micronutrients. There's 2 different MTHFR genes, and you can get this done at LabCorp or Quest, but it doesn't tell you all of your other markers like 23andMe does, because you may say, okay, I'm heterozygous 677, so that means I've got 30% less methylation, but it doesn't tell you if one of the receptors that sits outside of your cells that grabs the folic acid, if there's a teeny weeny number of those. So you may have much, much, much less ability to pull the methylated folic acid into your body, even though it says, oh, I only have 30% reduction. So we talked about what functional medicine is, how important the gut is, and how why celiac is, there's 3 triggers for it, and the 3 triggers for autoimmunity are a genetic predisposition, a trigger of any kind, and a leaky gut. And neurotransmitters are produced in our gut, about 90% of them. So if you treat your gut, many times you can balance those things out. And then you can add a few things in. You can come and see me for a functional medicine visit. You can get your genetics done and get your SpectraCell done.